Hi everyone, welcome to Pioneer Advanced Hair Transplant Center. Well, basically in earlier days, choosing a transplant clinic or selecting a surgeon was very easy because hardly very few guys were there during 2006 to 2012. So choosing a clinic or best surgeon, it's kind of picking up out of three or four was very easy. Now, fortunately, unfortunately, awareness has been increased, and each city has more than 500 to 1,000 clinics. And everyone is going to post their videos and their results and videos in Facebook, Instagram, and YouTube. I'm sure it is very painful procedure for the patient to choose the best clinic, and most of the clinics will charge minimum consultation. It's not practically possible to go around all the clinics, take second and third opinion, and finalize one. So in that perspective, and patients also getting confused with a lot of media inputs. So a lot of videos are coming on the Facebook and YouTube, and they're really not able to understand which is the correct one, which is good one, which is authenticated one. And well, apart from that, and there are few clinics, there are no doctors, they also post the videos as a owners. Then more confusion among the patients who really wanted to get their transplant done. Apart from that, there is a patients really having a time constraint. Basically, they want to travel abroad, then they have only 7 days to 10 days time. They've been so hurried to get it done, their transplant, and obviously they go and fall as a prey for some clinics who's going to give some offers, or there is no doctor where they get financially nice package, lucrative package. So, well, to make it to understand what exactly you're supposed to see before choosing a best clinic. So basically, how to choose a best clinic, best surgeon. So that's the idea of to make this video. This video, I'm sure, kindly watch until end to understand what is the quality that you're supposed to look into. I'm going to show one video with the results to make it to understand how to choose the best clinic. What are the few points to be noted? Well, as I earlier discussed, basically 2006 to 2012 in Bangalore, basically hardly we had 5 to 6 surgeons who were operating for hair transplant. And among them, maybe you can choose best and go for their transplantation. That was a kind of easy for most of the patients. Well, today, more than 500 or 600, even 1,000 clinics. There are few places doctors are there. There are few places doctors are not there. But combinedly put together, there are many clinics offering hair transplant and cosmetic surgeries for you. It's definitely a painful part to the patient to choose the best one. In this video, I just want to make an important point to be noted. Kindly see the hairline design, hairline outcome, how natural it is. If it is natural, if it is undetectable under sunlight, that means you are going to a best clinic or best surgeon. As simple as that. That kind of a video I'm going to show you today in this patient results. Kindly watch the video until end to understand it. I know there are further more points like observing the donor quality after the transplantation, density, which is practically may not be possible for the patients. That's the reason I'm talking about hairline, design, quality, and naturalness. If you can see these aspects in the hairline, you can find and finalize one best clinic for your needs. This patient, though it is a class 3 kind of baldness, most of the doctors does a mistake getting the hairline very much down and go with a robust hairline which looks like a doll appearance. So even patient would like that at times, but once you get the hair completely grown, then patient will not like it. So kindly watch out your hairline design when you are talking to your surgeon. It's most important aspect to be discussed before a transplantation. In this patient, I have taken a reasonably higher hairline which matches to the patient needs. There are a few calculations in my mind, and even I explain to the patient to make him understand that that's the reason we have taken that kind of hairline. Well, here most of the patient may be unsatisfied and they would go for the different options, but I'm sure they end up in kind of a disastrous outcome. So that is an important point to be discussed before surgery. Most of the doctors will bias it, and they don't even discuss with you because they don't want to lose you. So whatever the way you hairline they will design, and end of the day they blame you. So don't go with such discussions and surgeries, because you need to be very clarity, have some clarity on the hair transplantation hairline. That hairline leads to what kind of progress you have to understand. So basically, whatever your hairline you design, the same way you don't look after hair transplantation results, you look something different. So those kind of examples your surgeon has to show you before doing a transplantation, as well as even if you take the hairline down or a little placement down, what are the consequences that you're going to face? Your surgeon is supposed to discuss and supposed to show you some visuals. So in that perspective, I have taken a little higher hairline, assuming that in the future you would need a few more grams. And though it is a class 3, we designed that such a way that he's going to get a beautiful natural hairline. If you can observe the density, unbelievable blending to the existing hair, supernatural kind of impeccable naturalness in the hairline, you can watch it. And when you comb it back and sides, no one is going to detect your hair transplantation. So that's the beauty of the hair transplantation. So when you try to comb it, the hairline is supposed to be very natural, just like your natural hair. That's the most important point has to be considered. That is not only starts with marking the hairline, and also it has to go with the surgeon's expertise and surgeon's skill. Simply marking a hairline doesn't give you results. That's the second point. How best your surgeon is going to be place your artistic hairline, and that's relies on surgeon's artistic hand as well as the experience. So, well, basically, by observing the hairline, you can decide the quality of the transplantation. You can decide the artistic hand of the surgeon, and you can decide many things. Well, hidden qualities like density issues. When you see the backside donor management after one session of harvestation, how badly it is donor is damaged, also comes under quality. But well, you cannot get to see that backside views. When you go for a second surgery, when a second surgeon definitely will tell you whether this first transplant harvestation was well or not, because most of the clinics, the harvestation part done by not surgeons, done by technicians, which is not recommended for you, and rather they are harvesting 1,000 grafts, they would damage 1,000 more extra grafts. So here in the visuals, for the visuals, you have to see about hairline quality, hairline placement to understand whether the transplantation clinic is a quality one or not. You cannot see that. Those things probably your friends or relatives or different surgeon can tell you how badly your donor is managed. So be careful when you are getting your transplant done. Kindly go to a best surgeon who has artistic hand and a passionate surgeon to get you a very natural hair transplant done for you. Because of that, in the future also, if you need another sessions, we can plan it without having much donor damage in the first session. Thank you.